Hello, guys. This is Matt,
And this is Nan.
and welcome to Matt and Nen podcast. Today, we would like to speak about a topic that we have seen to be important, and that some of our people would like to hear. What are our views about it, and it's particularly about health and food security in the country, and the devastating impact that recent development in the aid sector and the development sector have had on this specific two issues. Thank you for joining us, and we hope that you will enjoy this session. Yeah.
Yeah. Thank you, guys. Welcome to the show. As Matt said, we're going to discuss about the healthcare and the food security within our country. Yeah, I hope you follow on.
So yeah, I mean, since the last 1 year since the coming of the new administration in the United States, there has been a number of development globally, but particularly in many African countries that depend on humanitarian aid, on development aid that have been provided by the U.S. government through USAID. And of course, we have not been spared by those impacts, particularly, those critical structures that are linked to healthcare and food security in the country. So this is why for us, we thought that it would be great to share how this is impacting, a lot of our populations and communities.
Yep, I totally agree with you. We could see the impact that the national NGOs has done in the world, in particular the African countries, in country like Sudan, country like South Sudan, Kenya, and Uganda. There are a lot of refugees who depend on these services, and we just try to go deep to understand the impacts if they are there and what happened if they are not there. So, Matt, I just want to understand more about the impact that these people bring to our community in terms of healthcare services. What does the government provide in terms of healthcare services, and what are they supplementing to provide to our citizens who cannot be reached by their own government? So this is a big topic for you. I know you have worked in this type of areas. You met people, you interview people about the effects of these services and what it can do to a community, and how do we get out of it if we become independent and you are able to make your own. If a government is able to set up an hospital and run that and maintain it, well and good, that's fine. But if the government cannot do it to the citizen or to the people living in that location, then it becomes a big problem. And civilian depends on those services. And when those services are not there, and then it becomes a challenge for those people. So, uh, as in terms of healthcare in South Sudan, like who is responsible for that?
So basically, I mean, essentially, the government, based on many international, conventions, has the overall responsibility to make sure that healthcare is working in the country. They develop a strategy, of course, ideally with the support of World Health Organization (WHO), with many other organizations to support it to develop those structures. In South Sudan is ranked as one of the least, developed countries in terms of healthcare. I mean, and also other sectors. In the health, in South Sudan, there is only one uh, hospital that is, I mean, that can be able to conduct, um, that can be able to conduct, like a complex operation. And this hospital is Juba Teaching Hospital, is in Juba. And even that, it's not to the standard that you would imagine. For example, if you had complications that are linked to, internal organs like heart or kidney, it would not be impossible to do that operation there. You would have to be taken to outside countries, like nearby countries, or to India or to South Africa. So in terms of healthcare, from what I remember, according to recent reports by many UN agencies, uh, healthcare received, I mean, based on the budget that has been allocated by the government, it only received 19% of the government budget. And in terms of that budget, until today or until recently, only about 7% of that 19% has reached, the healthcare centers. So it's just incredible. I mean, if you look at it, if you look at some of the state in the periphery outside Juba, in Jonglei, in Unity, in Upper Nile, in Northern Barghazal, in Warab, in Central Equatoria and Eastern Equatoria, they largely depended on USAID and other humanitarian organizations. So with the withdrawal of USAID, many of these hospitals have virtually closed. There was for example, a state hospital in Unity State in Bentiu
Yeah.
as closed, as closed. I mean, it's in the process of closing because there is no funding. Like the withdrawal of USAID has caused many of the implementing agencies that were working there to pull out, and unfortunately, the government is not able to to chip in and take over those responsibilities because it's basically broke. So that is as far as I remember, and it's the same thing in Apanal region. I mean in Apanal state, in Jonglei it's the same, and in many other states is the same.
So what I'm hearing is that the government allocate 19% of the national budget into healthcare, and then that 19%, 7% is what eventually gets to go to the healthcare center. If you talk about 19%, what in terms of money, in terms of dollars, in terms of billion, in terms of million, how much money are you
So
talking in
it
terms of 19%?
So the 19% from a report that I read recently that was published by the UN, the 19% is $39 million. So we're talking about a country that has one of the least, that has one of the highest maternal death in the world, that has one of the highest, malaria outbreaks in the world. All these non-communicable diseases that in many of the countries have been eradicated. Those diseases are still prevalent in South Sudan. So we're talking about this 9% of $39 million. So that is almost a drop in the ocean.
Well, I would say that money is very small. If you talk about a country that has 10 states, if you come down to dividing it into 10 states, let's say one of them is going to get 1.9%, that is actually going to that state. Now you go down to counties, that's how many counties in the state? That's a lot of counties.
72
Or you
counties,
go,
yeah.
that's 72 counties divided by that, the money is gone. And we also have uh, areas of administrative area within South Sudan. So we're talking about that the importance of NGOs, because if the government is giving that percentage to the people to allocate to those states, and now the government doesn't even know to consider the corruption, that this actually doesn't even get to the hospital, it doesn't even get to the healthcare. So when you include corruption is going to take another percentage. So basically,
No,
there's a
I mean,
0%. That 0%
there's almost
arriving to the
nothing. I
people
mean,
that
if you
needs it.
go now to the countryside and try to go to a state hospital. I was looking at pictures recently that were being shared by a friend in Reng County. Reng is at the border with Sudan, and there's a massive influx of Sudanese refugees, of South Sudanese returnees, millions and millions. So if you go to a state hospital at Reng, not a state but county hospital, there is almost nothing. They have shortage of everything, of medicine, even gloves that you use to handle patients, even syringes. People are complaining that they have nothing to be able to do their job, let alone like a personal protective equipment. They don't have that. Things to use on the patients, malaria drugs, all this kind of stuff they don't have, let alone operation to if you get sick, in the countryside in South Sudan, you literally, at the mercy of God. If not that, you're going to die because there is no the nearby hospital. For example, if you are in a county like Neural County in Jonglei State, the nearest hospital where potentially, an operation, a complex operation can be done like a gunshot wound would be in Akobo. And to go to Akobo, there is no road to get there. During the rain season, almost everything is closed. Like you need to fly in a distance of about 10 kilometers. You need to fly to be able to get there. And where, of course, are the people going to get those services? So it's just, it's unbelievable that, people are still living in such conditions in 2025.
Yeah, let's just accept that all the states and the counties are not getting enough money from the government to be able to look after those people. Let's say people are living in POC, protection of civilian, that's set up by UN. That's like a lot of people living in that place. You could see the emergencies that happen there, the people that get sick and things like that. Because when you bring people together, one person gets sick, everyone is already sick. So you could imagine areas or countries that doesn't have a hospital or healthcare. It's actually a big disaster for the government or for the people or for the authority that lives there to actually manage, because if you cannot provide these
It
services,
is,
this
and
healthcare is human right, you know, healthcare, I can say
absolutely.
healthcare is a human right, because people are paying tax, people are paying all this money, companies are paying tax, they're paying registration money. Where are this money going? These are the things that should go to healthcare. So people become healthy,
But
and if they are
that is
hungry,
the
they,
thing
you know,
because the thing is that it's not that there is no resources in South Sudan. South Sudan has enormous, resources. We talk about the production of oil, even though it's now been affected by the conflict in Sudan. There's still a lot of non-oil revenue that the government could use to be able to support, these sectors that are very important. You talk about healthcare, education, and food security. But there is just inherent, lack of responsibility for them to be able to take this as part of their job. And let alone that, I mean, even if the people at the top would like this to happen at government level, but it's corrupted in the process. If you send, for example, $1 million to a hospital in somewhere, in Lake State, probably only 1% of that money would reach that hospital. So that is where we are. This is what we're talking about, and we would like, to change this. We would like to make sure that there is a bit of understanding of these basics, because for a government to be able to function well, you also need a healthy population. How are you going to have workers that do not have a hospital? How that do not have
everyone's
food
going to
to
call in
eat?
sick. Everyone's going to
Yeah.
call in sick, and no one is actually going to be able to work, and you cannot even get those money that you're trying, the revenue that you're trying to get from taxpayer, because they don't go to where it should go. So it's good that you give me an insight of what is happening back home. But for me, I did a little bit of research. I did a little bit of research with a friend of mine that worked and live in POC. You know, I've talked to them. I said, "How do you guys live up? Who is actually funding the actual hospital there?" They said it's USAID. Now the US is gone. This has been withdrawal, but these people were able to fund the salary for people who are working there. They are funding the maintenance of the hospital. They're providing the primary care. There's no secondary care at hospital. There's only a primary care. When you get sick, they look after you. No one look after you after that. So this friend of mine talked to me and say, approximately it's about £512 in US dollar a year that US IAD is providing to those people. So with withdrawal of USID, what does that mean? What does that mean to our
No, I
people now?
mean it means that, I mean, according to research that was done by some specialists recently together with the WHO, it's projected that especially in developing countries and poor countries like South Sudan, like in excess of 14 million people could die in the next 10 years because of this withdrawal of funding. And that is because, like the critical structures that were being funded will now be nearly, gone. You're talking about child and child care. I mean, nutrition provision for children under 5. You talk about pregnant and lactating women that were receiving most of the support. In and to remember that 80% of the population in the country in South Sudan live in the rural areas. So those are people that have no access to any service, even if it is commercial, that they could pay for it, or somebody like a relative or somebody, a good Samaritan, would pay for it. They do not have access to it. To travel from, from a deep village in Western Barkazal to come to Wow, it takes forever because there is no infrastructure to reach there. So the impact that these cuts are going to have are immeasurable. You talk about POC, there is nearly 300,000 people living in POC in Malakal, in Juba, and in Bentiu. These are, cramped human prisons, to be honest, because uh, like people depended largely on this because they do not have they don't feel safe to be able to go outside and take part in the economy and work and do other things, or even to go back to their home areas. So all of this will be impacted. We talk about nutrition, talk about healthcare, education, food, and psychological support as well, because these are people that have endured over nearly 15 years of conflict now.
How long has it been since 2013 when they start the POC for the UN mission in South Sudan? It has been how long?
Yeah,
It has been 12 years.
it's
Imagine being in one
12 years.
area
Yeah.
for 12 years and you are not able to go outside to go and do your own cultivation, go back to your village and things like this. This is traumatizing
And
for people.
it is. And there are kids that were born there who have not gone to school. I mean, talk about 12 years. These are almost teenagers. And they are not accessing good education. So, like, their future is literally being wasted while they're in these camps. So it's a lot of a lot of compounding issues that are linked to these cuts, and a lot of people, in the country, even in the cities in Juba, people will suffer because you mentioned earlier about people losing jobs. There are a lot of people in different sectors that were employed in these parts of in this business, let's say. There were, but now, with this, there's nothing.
Well, I can tell you the sole employer was the NGOs that were employing people in those areas. Now, these services is not there. It means that those people will lose their job. They have children or families that they support in Eastern Africa. Let's say in Uganda and Kenya, there's people there that they are supporting, and now the job is cut. What are they going to go? Where are they going to go? Is government going to help them? Who's going to actually be responsible for this disaster? Because I call this a disaster. If people don't have job, people don't have food, people are just going to go mad. Like, what is going to happen? Like, what do you see is going to happen? I can see that's a disaster in our country already.
There will be, because it's not only it's a catastrophe, because if you look at having, we talked the other day about the population of the country being mainly made of youth. So this youth, where are they going to go? Because they need to work, they need to be involved in some activities. But if the government has not created the space for them to realize some of their skills and talent, of course there will be conflict. I mean, that is any conflict, specialists will tell you that this is a recipe for disaster, because all these people will melt into the society because they have nothing to do. And you will see going to refugee camps, going to nearby countries, and also internally, you can imagine that if you have all these young people doing nothing, there will be a lot of strife. There will be crimes are probably going to go up. And again, like the living standards, the human development standard of the country will go down, because what drives, a population, or what drives a country, is its youth. If they're not employed, of course, you're going to have this. And it's not because that this is this USAID, was the sole, sector that was able to take care of people, but it's just because the rest are not working. The agriculture sector is there. Tourism could be there. A lot of businesses could be there. There is oil in
You
the
can't.
country. I mean, the oil sector could potentially, employ almost all the youth in the country. But it's just that it's not working as it should be. it's run in a very opaque manner. We don't even know where the revenue is going to. So that is how I see it, that it's potentially going to be, and we're just going to have to wait and see.
Well, you talked about tourism, you talked about agriculture, you talk about working oil sectors, you talk about many things where a lot of our young people can do. But without a country that's under control, this type of thing will not happen. There's no peace. But everything is up in the air. We're just praying to God that we see tomorrow. Otherwise, we don't know if we're going to see tomorrow or not, either through hunger or through disease or through something else. So um, it's very bad for us. And I just want to see, what do you think our country is going to do about this?
Yeah, I don't know. I mean, I don't think there is any strategy to be able to salvage the population from what I see. I see that their priorities are different. They're pursuing different priorities. If you look at, if you follow up the events that happen in the country on a daily basis, you're just going to be frustrated because there is no immediate steps that are being taken to salvage the situation. Nobody's doing that. You have, I mean, I believe there's a lot of competent people in government that could do that, but there is no will. And I don't know. I mean, how you can be able to run, a system without thinking about the people, which uh, eminently the government is supposed to serve. The government has the responsibility to take care of its population. Nobody else is supposed to be. Even though, we talk about, the presence of all these non-governmental organization and UN, they're just there to supplement. They should just be there to supplement during disaster. But the government has the ultimate responsibility. Uh, and you've seen, like, I mean, you've seen probably in the news, and I follow closely that there's flood, there's an outbreak of flood now. How do you respond to that? Who should develop that strategy, for example? You know?
Yes, like we mentioned before, that there's flooding everywhere, in almost in South Sudan. And again, people outside the country, especially people who are from outside Africa, they said maybe the services that the NGOs are providing to us are there to control us or to make us lazy. But in terms of South Sudan, I don't think if this thing is making us lazy, because if you cannot go and make your own food, you cannot go and make your own business, you are locked in the area where you cannot even go outside because you will be killed. So people are saying that maybe this UN aid and things like this, they make African being colonized. What do you see? Is this a colonization, or is this between people going hungry, people dying, and all these things? What do you see? What do you comment?
I mean, there's definitely a lot to be unpacked in terms of this sector. I mean, I would not go into the, details of how people perceive, this kind of interventions and support. But what I do know is that uh, in many cases they are necessary, you know, especially in places where, it's a country like South Sudan, very young, a country with only 14 years. You need everyone you can get, but I'm not sure about, the strategy that has been put in place to be able to develop the capacity of the state. So I think this is the most important thing. But I also do not think that those who would like to support the capacity of the state can do it, by force. The state has to accept that I need this support from you, and you need to you give it to me. The state need to accept that there are certain areas that is not great at, and you can solicit the support of experts. It doesn't necessarily have to be people within the country. You can rely on people from other parts of the world, from the region. But I mean, there is a dual, you know, purpose of this, aid industry, and depending on who you ask, people can say it it encourages people to be to depend on this kind of free goods, but it's also, in many places, it's the lifeline is the difference between life and death in some cases, and I've seen this myself. For example, I mean, when the conflict broke out in 2013, in 2014, I was in the country and I was working there, and I saw there are places where people could not survive. And so this is how the question is, what is the exit strategy? There should be an exit strategy that is developed together with the national authorities that will provide, sustainable solutions to the population to be able to take care of themselves. And we could tap into the traditional, means of production, and and then just work with that, because you can continue to give, but until when? There has to be an end to it, and there has to be in a transition manner, not like what happened in Afghanistan, for example, just to leave overnight. There has to be a transition. So that is how I see it.
Thank you for that. And also, I have another question for you, and also for me myself. People are willing to come and help. People in our community, they have money. They would like to invest. They would like to build hospital. They would like to bring medicines, and so that our civilian can buy them. For me, I don't see there's a pathway for these people to be attractive to come home and do this type of activities, because there's no place, there's no safe place, there's no road, there's nothing. Like how like, let's say I have money, I have a lot of money. I want you to convince me to come to your state and do these services so that I can get a return, either people being happy or maybe you giving me profits in terms of small money. Like, how can you convince someone who has money that this state or this place is the best for you to come and help our people and come and invest here? Like, what type of
I mean,
strategy would you use?
the thing is that in as much as I would like to convince you or anyone, or even myself, that I should go back to the country and do something, but it's very difficult to do that, because the basic infrastructure to be able to do that are just absent. So I've also tried myself in many forums to pitch some ideas to people that I would believe could bring some sort of support, because it's not necessarily about free thing. You can have investors come in. So for me, and do their thing, out of profit, they would employ people and bring goods that are necessary for the people. But the conditions are just not there. Today, if you go to mention any state, aside from the Juba, the capital, there's no state where you could drive by road from Juba and reach the state and say that I want to establish some business. It's just incomprehensible. It's not possible. So it's just difficult to convince anyone, and that is because uh, the country has been plunged into a state of this like just dysfunctionality. So I think it's difficult to convince anyone. Only the those who are in power can be able to do that, and the only way you can do that, because you cannot forge peace through through just talking about it. It has to be seen. I mean, today people have access to the media, so they will they can see for themselves. They need to see for themselves. If you say there's peace in Rwanda, is there anyone who can dispute it?
No, no, they
No
will,
one
like
will
I said, I
dispute
would
it.
totally agree. I don't really care what you do with the government. I really want to know that my stomach is gonna have food tomorrow, and I will be able to go to market and buy their food. What I do care is that I go to hospitals and I will be able to buy the medication. I will be able to see the doctor that will tell me what's wrong with me. So in reality, it doesn't matter what the government do. If these services are not being provided to the citizens, then our country is just up in the air. Like, for example, we have state governors. What are they doing in city like Juba? The state is located a mile away from Juba, and they stay in
Absolutely.
Juba. Why can't they stay in the city where they are the governor for, so that they live together with the people that are there, and then they actually feel it, be in the same location and actually see how life is there. They would go every
But you
now and
can
then, maybe every month.
you can go as far as
Yeah.
saying, why are they in many of them, they live in foreign countries with their families live in foreign countries. You can go as far as asking, how can you be interested to change the situation of your population if your kids are not living there? So that is the fundamental issue, that there are many of the
This
the, the
is
people, the executive, the state governor, the people in national government, their families do not reside in South Sudan. So how can you be interested in developing a country that you do not have a personal interest in, aside from what you can extract from it. So that
This
is
is
something that needs to be to be rectified, because if your children, if your four children are living in South Sudan, of course you want them when they get sick to go to a good hospital. But if they don't live in South Sudan, what is your interest?
you have no interest at all. Whatever happened because you will call a flight and you will be picked up and you'll be taken to a safe haven. So we need to do something. We can't keep going like this. People have to see it from the way I see it, from the way you see it, from the way everyone sees it, because it's not all about that person is going to deliver, because they will never deliver. Imagine I'm driving my car in United States. I have to come to Juba to register that car in Juba so that that money I'm using for registration stay in Juba. It doesn't go back to where it come from. How is this making sense to you? Why is every asset from the state is being nationalized? How? Where in the
But
world
that's,
is that?
that is the type of government that we see, the type of governance that we see, and there has been a lot of voices in the civil society, even in the peace agreement, to devolve, to decentralize the state governments. We need to go as far as to send some ministries to the states. Why do you have to keep everyone in Juba? Juba is like the small village where everybody is. So, as you said, I mean, many functions that could be decentralized, like registration of motor vehicles, uh, things like national IDs and passports. Imagine if you want to get a passport, you need to come to Juba to get a passport. Even an ID, a government issued ID to be able to get it. How many people can afford a flight to come to Juba and get the ID or passport? And we used to have three international airports, one in Juba, one in Malakal, and one in Wow. Now there's only one international airport. It means that if you want to travel, you need to come to Juba to take another flight to travel. Where do people have access to such kind of resources to be able to travel around? So like, and a lot of people agree with this. Even the government authorities themselves, those who work in the state government, they agree that they need to have, decentralized, government institutions based in their at their level. Talk about the justice, like the justice branches of the justice ministry. They need to be decentralized so that people can have access to justice. So it's just, there's a lot of questions that you could ask, and we can go on and on about all this.
If I may ask questions, I'm not aware about it. But is there any country in Africa that is like the way Sudan is being run, or how South Sudan is being run? Any example?
I mean, I always say that I mean, when we talk about it, we have to self-purge. So we need to accept that we're probably the worst globally. I mean, we were at some point, when we got independence, we were at, we were better in terms of GDP per capita uh, than most countries. Now we have slipped down to the lowest global out of over 200 countries. We are the lowest, imagine, and we're a country of 10 million people that is pumping, so much oil on a monthly basis. So there is no excuse for us to say we are poor, we don't have, we have everything we need to be at the top. We could be, as good as the Gulf countries, to be honest with you, or if not better, because for them, they have to desalinate drinking water. For us, you just go to the Nile and do a little bit of, treatment, and you have your water there. So there is no excuse, but we are the worst, if I have to say, to admit.
Even even being the youngest country in the world, is that not an excuse that we haven't got
It's not
our
an excuse because we
our?
were born
It's
in the
not
20s, in the
all
2000s.
right.
There is no excuse.
Well, if there's no excuse, we don't know who to blame. We can take this to the government and government look at it. But I think our people, our civilian, they are going to go through a tough time in terms of food. There's a lot of disaster going on. There's flooding. They're not cultivating. There's insecurity. What is going to happen? We do not know. And this is why it's good to discuss all this topic, because if we don't discuss them, no one is ever going to come up and tell us what's happening. To our listeners who are not from South Sudan, who are not aware about what's going on, our country is going through crisis where all the NGOs that used to help us that's now full out of South Sudan or slowly cutting their services a little bit. We have a lot of refugees in the nearby country like Uganda, Kenya, and a lot of those people want to come home, but they have no home, they have nowhere to go. So this topic or this discussion is based on how can we improve or how can we make our country better for our people to come back home. and for our people within home to actually have a peaceful country where they can go to their villages and cultivate their own food and and contribute to the development of our country. So I give it back to you. We have
Yeah,
talked a
absolutely.
lot.
Absolutely, absolutely. Yeah. I mean, we just to conclude, to finalize, it's a it's a issue that affects, of course, many African countries. We can only speak about our situation because this is what we know. But it affects a lot of countries in Africa, and that we need to be able to push for narratives that are supposed to change the lives of the of our fellow citizens, and no one will change this. We have to stand up and say this needs to change. We need to give ourselves the challenge to say that by 2030, we need to say that we need to eradicate this. We need to eradicate malaria. We need to be able to connect at least all the states with the paved road. We need to be able to connect all the counties with paved road. We need to make sure that there's at least one, secondary health care center in all the counties. These kinds of challenge we need to give it to ourselves and challenge those that have the responsibilities, that are in power, that are holding the resources to be able to push those, to make those happen. This we need to make this very clear. Otherwise, we will not be at the mercy of other people to get us out of this nightmare. No one will do it. No one will ever to get you out of this nightmare. You look at what happened, for example, Japan. You know what happened in 1945. They were devastated to the ground level. But look at them now. They are actually the ones supporting us. They're supporting us, you know. So there is no excuse, in my opinion.
Yeah, and in some other country, people complain about electricity. When it comes to our country, I know electricity is something that in demand for people to use. We haven't talked about it. It's part of, I could say it's part of a human right, and it's part of government services where they can deliver electricity to the people, and people, if they have money, and then they can pay for it. What do you think about the electricity services in our country?
I mean, I don't know. I mean, it's like you said, it's a human right, but it's absent. It's largely absent. I mean, aside from few private companies that provide low voltage electricity to certain urban centers, like Juba, Wow, Rumbek, and Yei, Malakal. There is no national grid, and we're surrounded by countries that have uh, enormous external access electricity. Our neighbor in Ethiopia, Ethiopia could power, according to many, like in terms of the capacity they have, they could power the whole of Africa. Imagine. And guess where the electricity is the most expensive in the world?
In South Sudan.
Yeah, so just that gives you the impression because it's just extractive, like people are just extracting as much as they can because there's no national grid, there is no, and we could potentially power. We don't even need this external power. We could use renewable energy. We have enough water, we have enough sunlight. We could power our this is small population through all this.
I think what we really need is someone smart, someone who put the country first before their interests, because there's a lot of things that need to be solved, a lot of issues, a lot of problems, a lot of things that our children are going to say, what the hell did our parents do? What did they actually do when they were living? They
I mean,
died, they left out all these things. It's sad.
no, history will judge us if we don't do something. Uh, so because we have to prepare, we cannot accept that the next generation will live in the same, uh, you know, uh, terrible conditions that we are going through now, like our peers are going through now. We need to be able to change that. That in a decade or so, there needs to be something that people can say, okay, we change this from this. That's
100%.
my view.
I do agree with you, and thank you for having a conversation with me on this type of topic. My worry is that there's no healthcare in our country, there's no security in our country, there's food insecurity in our countries. I can see in the next 10 years there's no development going on. So we have to do something. Someone have to share in this. Somebody have to come and help us because we are trapped
Somebody has to.
in the
This
place
message
like.
needs to get out.
Yes, people have to come help us. It doesn't matter what country they are from, they have to come and help us. 300,000 people living in, I don't know, I didn't calculate the POC camps in Malakal, Juba, Bentiu. I did not calculate the area, but imagine 300,000 living on tiny little piece of land. Imagine the criminality that's going to happen, the diseases that's going to, it's just more than impossible to explain to anyone. Whoever is listening, we are in a disaster. As a citizen of South Sudan, we are going through a tough time. We just need a prayer. Will not even be considered as a thing for us at the moment. That's what I think.
But it's more than welcome. So thank you very much for this exchange. It's been great. We will we can't wait to hear from our viewers, their comments and feedback, and yeah, we look forward to that.
Thank you very much, and you have a good evening, guys, wherever you are. Thank you.
Thank
Bye.
you very much.